The topic of the talk is about the need for stratification in obesity. And really the talk will describes why is there a need for stratification. What is stratification, which is really identifying groups of patients who share similar phenotypic and natural history of disease, that these strata can now be used as subgroups in order to identify risk factors and to predict, for example, response to therapy. And the talk will actually deal with three topics about how one can go about stratifying beyond what we know mainly from the cancer field that uses genetic markers. And the first one is about simply taking the simple measures that we already have and expanding our knowledge about them a bit more, including in ranges of the parameters that we now consider as normal values. The second one is about the ability to use histological cellular components and histological features of the adipose tissue in obesity in order to use these as criteria for stratification. And the last part is really, since adipose tissue is available for assessment, especially the intra-abdominal fat is available for assessment only after surgery, whether we can find circulating blood biomarkers that would be indicators of certain phenotypes of the adipose tissue, such as the infiltration of immune cells into visceral fat. So these are the three parts of the talk.